taking a look at a picture, all of this in orange is going to be the retina. We also see the little indentation right here, which is the fovea centralis, and that's where we're going to find a whole bunch of cones. Now, one thing I also want to point out is the tissue that immediately surrounds it's not labeled on this, so we'll go ahead and draw it in. But in a circular fashion, just surrounding the fovea centralis is the macula lutea, and so we'll call that M for macula lutea. We also see the optic disc right here, which is just full of nerve fibers, which is also our blind spot. Taking a look at a different view, we can see this dashed line is indicating light waves. So as they pass through here, right where they're hitting down is where that fovea centralis is, and that's what's going to give us our clearest image. And we can also see the optic disc right here. The lens of the eye is going to be held in place by those suspensory ligaments found on that ciliary body. And so the muscle is going to relax or contract depending on what you're doing. That's going to change the shape of the lens. And so if you're looking further away, it's going to have a different shape than if you're looking at something closer to your face. There are also cavities that are formed in the eye. The posterior cavity is everything behind the lens, and this is filled with something called vitreous humor, which is almost like a jelly, and that is just going to help keep the shape of the eye and also push the retina up against the choroid layer. That way those cells can receive oxygen and nutrients. The anterior cavity is everything in front of the lens, and there's two parts to it. These two parts are called chambers, and something you always want to remember is that cavities are bigger than chambers. These chambers are going to be named just after their orientation. One's in front, one's behind. So anterior chamber of the anterior cavity is just the space between the iris and the cornea, whereas the posterior chamber of the anterior cavity is smaller, and it's just the space between the iris and the lens. Now, both of these chambers and the entire anterior cavity are filled with something called aqueous humor, which is more of like a watery type substance. So taking a look, again, everything behind the lens here, this is the posterior cavity, which is filled with that vitreous humor. Everything in front is the anterior cavity. And so there are two natural spaces created here. And first off, this first one between the iris and the cornea is going to be the anterior chamber of the anterior cavity. And then we have much smaller, the posterior chamber is just this space right here between the lens and the iris. You can see it's much smaller here. But that will be the posterior chamber of the anterior cavity. And those are what are filled with aqueous humor. On a different view, we can see those spaces a little bit clearer. So behind the lens, again, posterior cavity. Now we can see the posterior chamber a little bit better here, as it's just that space between the iris and the lens right there. And then we also see the anterior chamber is from the iris up until the cornea, just all this space right here. There are also muscles of the eye that we need to learn, and for the most part, they're pretty easy. Their first four are just named after where they're located, and also rectus, just telling you the muscle fibers run straight. So we have superior rectus, which will be on top. Inferior rectus will be on bottom. Medial and lateral rectus muscles as well. And then we have two oblique muscles. The inferior obliques just coming at an angle at the bottom of the eye, and then the superior oblique muscles coming at an angle from the top. Now, one thing we also want to know is their innervation. So what nerve is going to innervate which one? And so if you had the unfortunate, or maybe it was a good experience, of taking any kind of chemistry, you may have seen something like this, a chemical formula. But we're actually going to use it to our advantage for anatomy. So SO4, LR6 is this saying. And what that stands for is which muscle is innervated by which cranial nerve. So SO stands for superior orbital, and that is innervated by cranial nerve number 4, which is trochlear nerve. Lateral rectus is innervated by cranial nerve number 6, which is abducens. And then the rest are all innervated by cranial nerve number 3, oculomotor.